If you've ever felt completely overwhelmed by worry, you know just how isolating it can feel. So today, we're going to cut through all that noise and build a really practical, evidence-based roadmap for understanding and treating anxiety. Let's get right into it.
You know, this phrase from the clinical guidelines really hits the nail on the head. We're not talking about the normal stress of a big exam or a job interview. This is about that persistent, nagging worry over, well, everyday stuff. If that sounds even a little bit familiar, I want you to know that while it can feel like you're the only one, you are so far from alone.
In fact, here in Australia, about 1 in 7 adults will deal with an anxiety disorder in any given year. That's a huge number. And the most important thing to take away from that is that what you're feeling is a recognized and, most importantly, a treatable health condition. Just knowing that is a massive first step.
So, where does the journey to treatment even begin? Well, it starts with getting a real handle on how much anxiety is actually impacting your life. And this isn't about some vague feeling. Clinicians use a pretty practical framework to figure it out.
This is the question. It's not just about how much you worry, but how much that worry is actually getting in the way of you living your life. You know, going to work, getting chores done, or just hanging out with family and friends. That level of disruption is a really critical clue to its severity.
This table, which is based on the Australian National Survey of Mental Health, gives us a super clear way to think about it. Basically, professionals look at the impact. For mild anxiety, it might throw you off for less than a day in a given month. For moderate, we're talking 1 to 7 days. And for severe, it's disrupting your life for more than a week every single month. It can be really helpful to just pause and think about where you might fit on this spectrum.
Okay, so once you have a sense of the severity, we can start to look inside the treatment toolbox. And you know what? Decades of research really point to 2 main pillars, 2 highly effective first-line options for care.
On one side, we've got psychological therapy, and the gold standard there is cognitive behavioral therapy, or CBT. On the other side, you've got medication, usually antidepressants like SSRIs or SNRIs. I like to think of it like this. CBT is like upgrading your mental software, while medication helps fine-tune your brain's hardware. Both are incredibly powerful ways to get to the same goal, which is feeling better. So let's zoom in on CBT for a second. This isn't just lying on a couch and talking about your childhood. It's a really practical, skills-based approach. The whole point is to give you the tools to become your own therapist. So for example, you might learn to catch a catastrophic thought like, if I'm late with this report, I'm definitely getting fired, and then reframe it to something more balanced, like, okay, I'll try my best, and if I need more time, I can just ask for it. See the difference? A typical CBT program follows these 3 stages. First, you just learn about how anxiety works, the mechanics of it. Then, you start building the actual skills to manage it. And finally, you create a game plan for the future, so you know how to handle challenges if they pop up again. It's a really structured and, honestly, an empowering process.
Now, over on the medication side, those SSRIs and SNRIs we mentioned are recommended first for a reason. They've been researched like crazy. We know they work by helping to rebalance some of the key chemicals in your brain, and they've got a much more manageable side effect profile compared to some of the older meds.
So you've got these 2 powerful tools, CBT and medication. How in the world do you decide which path is the right one for you? Well, it's a conversation you have with a health professional, and that decision often comes right back to the severity we talked about a minute ago.
You can kind of see the general game plan mapped out here. For mild anxiety, just learning the skills in CBT is often a fantastic starting point. For moderate anxiety, it becomes more of a choice. You might go with therapy or medication, or sometimes even both. And for severe anxiety, the research is pretty clear. A combination approach right from the get-go often gives the best results.
But, and this is so important, please remember, these are just guidelines, not strict rules. The most critical thing is that this is a team decision. Your personal preference, what you've tried before, your specific situation, it all matters. It's a conversation you have with your doctor or therapist, not something that's decided for you.
Okay, so you've picked a path. Now for the million-dollar question. How long does it take to actually feel better? Honestly, setting realistic expectations here is absolutely crucial. It's what helps you stick with it and not get discouraged.
This is a direct quote from clinical guidelines, and I love it because it's so true. Whether you choose therapy or medication, there is no magic wand. Recovery is a process, not an event. Your brain literally needs time to adjust, to learn new pathways, and to heal. Patience is key.
This timeline gives you a rough idea of what to expect. In those first couple of weeks of starting a medication, you might actually notice some side effects before you feel the benefits. That can be tough.
but it's so important to try and push through it. Then, around the 4 to 6 week mark, for both CBT and medication, that's when people usually start to see some initial improvements. But the full therapeutic effects? That can take 12 weeks or even more to really settle in. It's a marathon, not a sprint.
All right, we've talked about what anxiety is, how it's treated, and what to expect. Now let's talk about the most important piece of the puzzle, how to actually take that first step.
You know, the guideline for when to seek help is actually really simple. If it's bothering you, if it's causing you pain, or if it's just getting in the way of you living the life you want to live, that's it. That's your sign. You don't have to wait for things to become a crisis.
And there are so many doors you can walk through. For a lot of people, their family doctor, their GP, is the perfect place to start. They can check in, rule out any other medical stuff, and then help you find a specialist, like a psychologist or a psychiatrist if that's what you need.
Look, if you take just one thing away from our chat today, please let it be this. Anxiety is highly treatable. You do not have to just live with it. There are proven effective treatments that can help you get your life back. There is absolutely every reason to be hopeful.
So, I'm going to leave you with this question. Now that you've seen the evidence and you understand the path forward, what is one small, manageable first step that you can take on your journey?